The head of the World Health Organization is warning that efforts to contain the outbreak of Ebola in the Congo are still behind. In what appears to be a reversal, the Secretary of State, Marco Rubio, now says Americans who test positive for Ebola in Africa could, in fact, end up coming to the U.S. for treatment. Last week, Rubio said the government would not allow any cases of Ebola to enter the country. The government arranged for Germany and the Czech Republic to treat two American doctors who were exposed to the virus in Africa, one of whom got infected. They did not come here to the U.S. Joining us now is Dr. Robert Redfield, former director of the CDC. Doctor, great to have you back. So what do you make of this reversal from the State Department, possibly now allowing Americans infected to come back home for treatment? This is after the government barred two doctors from coming back to the U.S. and arranged for them to get treatment in Europe instead.
Yeah, Elizabeth, I think it's the right decision. It's unclear. I heard the explanation that the State Department made was there was a misunderstanding that they were going to do the observation of exposed individuals in the Kenya facility. And then if people were actually infected, they could either go to Europe or the United States. I don't know. I wasn't part of those decisions. But clearly the right decision is made now. When I was a CDC director during the 2000, or actually when I was at Maryland, before I was CDC director in the 2014 outbreak, we stood up of 13 centers across the United States, including one that I stood up in Baltimore, that were trained and prepared to take care of patients with Ebola. I think it's important that the Americans, if they do get infected, many of these are missionary workers, they are given the opportunity to come back to a U.S.-based facility that really has the expertise and the equipment to take care of this disease. When I was CDC director with the Zairian outbreak in 2018, it had a 70% mortality.
Yeah.
If we got people into good facilities, we can reduce that mortality to under 10%.
The current acting director of the CDC wrote an op-ed that's out today saying, touting the U.S. moving aggressively to address the outbreak. And talking about this new isolation ward in Kenya that you just brought up, but that ward is not open. There's huge public backlash in Kenya. Kenyan doctors are saying no. They said if it's too dangerous for America, it's too dangerous for Kenya.
Yeah, I know the debates that are going on. Again, I think the point that is really on the table is for the individuals that are exposed, that they could
be... So not yet infected.
That's right. They could be in isolation in the region. In this case, the U.S. government has worked with the Kenya government to have it there. But the individuals that are actually infected, I don't anticipate they would be treated in Kenya. They would be offered the opportunity to be treated in Europe or the United States.
The part of the issue here when it comes to battling this epidemic in Africa is there is massive mistrust and misinformation. It's so bad in the Congo that locals reportedly believe that the tall antennas on the cars of Doctors Without Borders was spreading the virus.
Yeah, there's huge distrust. I mean, when I was CDC director, I had 3 Ebola outbreaks in the DRC, including the 2018 in the northern region, a little south of where this one is in Turi. And the amount of distrust in that environment is huge. They've been at conflict for over 25 years when I was there, now more than 30 years. There's more than 25 fraction groups fighting each other.
Yeah.
They don't trust the DRC government, and they don't trust the aid workers. And so, as you know, I mean, even when I was there, I had to have high security. I frequently had to travel in a tank.
In a tank?
Yeah, and they actually attacked a number of the hospitals, killed the nurses. So there's just total distrust in this area. It's going to be very complicated. They don't trust outsiders. They don't trust their own government.
Yeah, you talk about that. I mean, we're looking at video now. They set fire to a couple clinics. 3 of them have been set fire. In one town, a large crowd attacked the director of the local hospital after the town pastor died of Ebola. There was a 5-hour siege and gun battle between hospital security forces and the townspeople who didn't even believe the pastor died of Ebola. They thought he died of malaria.
Yeah, huge distrust. And as you know, one of the things that fuels this is the family members want the body. And one of the worst things we can do to contain Ebola is to release infected individuals' body, because they're highly contagious and they can infect a lot of people. So one of the public health measures that's done is the bodies aren't released,
Yeah.
and that causes a lot of anger among the citizens that don't trust the decision-making process.
Do you still think that this epidemic has the capacity to spread further and wider and become a huge problem?
Yeah, I think this will become the second largest pandemic in Ebola in the history. I told you I did the third largest one in 2018, and it was about 3,500 cases. This one's going to definitely surpass that. Whether it surpassed the 2014 outbreak, I don't know. It's going to stay regional. I think it's going to be the DRC, Uganda, maybe in South Sudan, possibly Rwanda, possibly Tanzania. So for that part of Africa, it's going to be a very big problem, a lot of mortality, a lot of disruption. Unfortunately, it took, as you saw the news today, the mayor in one of the towns, bold towns where it started, said that the first cases actually appeared in February 22nd.
Way back in February. This was
February
spreading
22nd.
for a long
That's right.
time.
So we didn't pick it up until the 15th of May. And the most important thing about Ebola initially is early recognition and really getting infection control in the hospitals and the healthcare providers up to pace. So I do think this outbreak has seeded a lot of people, and I suspect we're going to see many more cases in the weeks and months ahead.
Dr. Robert Redfield, I really appreciate your expertise. It's really not a great situation. Dire over there. All right, thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.